are here today to discuss the impact of, yes, the longest ever federal government shutdown on SNAP, and we all know that's the Supplemental Nutrition Assistance Program, and food insecurity amongst our East Harlem neighbors and our Hunter College community. First and foremost, I want to thank President Nancy Cantor for making Hunter's role as an anchor institution such a clear and compelling priority. In the short time she has been with us, her vision and leadership have inspired a college-wide movement grounded in partnership, purpose, and equity. Our Department of Nutrition and Public Health is privileged and grateful to share space within the Silberman School of Social Work here in East Harlem. Thank you, Dean Kavanaugh. A partnership that strengthens our shared commitment to the well-being of this community that we are so proud to call home. Now I know that I'm preaching to the choir when I say that food is a basic need, not a privilege. And when that basic need goes unmet, students are unable to focus in classes, families struggle to put groceries on the table, and communities bear the weight of inequity. I am truly honored to lead a school that recognizes that student academic success is inseparable from meeting their basic needs. Our commitment to student well-being is reflected not only in the strong academic programs that we have here, but also in the direct support we provide them through initiatives such as the Purple Pantry and the Pantry Link vending machine program, which you'll hear more about today. Many of our neighbors, including students right here in this very room, are already navigating tight food budgets. As federal support diminishes, these pressures only intensify. Hence, our goal here today is to understand this ever-changing landscape and engage our students, the future leaders of tomorrow, in seeing how policy decisions shape health and equity outcomes. This afternoon, you'll hear from exceptional panelists. We have Dr. Wen-Yuan Wang and Dr. Jera Zhang, along with our graduate student Savannah Sclafani from the Department of Nutrition and Public Health. We have Dr. Keith Chan, who is from our Silberman School of Social Work. We have Assistant Dean Miesha Smith from Student Life. We have Jocelyn Caceres, Director of East Side Soul. Welcome to Hunter, Jocelyn. And last but not least, we have Dr. Mark Chatarpal, the Executive Director of our Hunter College Food Policy Center, who in just a couple months of being here has already brought tremendous energy and focus to his role. I want to thank him and, of course, his team for pulling this together in less than, 3 days. I also want to thank our distinguished panelists for joining us. And we are grateful to everyone here in person as well as online, especially our students from nutrition, from public health, and from social work. You, my dears, are, yes, tomorrow's innovators, trailblazers, and change makers, and we thank you for coming together to participate and engage in this vital conversation. Now I'll turn this to Mark, who will offer his welcome remarks before introducing the panel and serving as the moderator. Welcome again, everyone.
Thank you very much. Thank you, Dean Navder. And good afternoon, everyone. It's a pleasure to meet you all. And I must start off by thanking my team for your amazing hard work and for pulling this off within a short period of time. Needless to say, my name is Dr. Mark Chatarpal, and I'm the new Executive Director of the Food Policy Center here at Hunter College. I am thrilled to join this incredible community and to see so many students, faculty, and staff gathered to talk about one of the most pressing issues facing our city, the country, today, and to address this major issue of food insecurity. It's an issue that touches policy, public health, and daily life, and that's where the Food Policy Center comes in. Our mission is to bridge the gap between research and action, between policy and people. We want food policy to be something everyone can understand and take part in. Our team translates complex legislation, policy debates, and academic research into clear, accessible information that helps community members, advocates, and decision makers take action on critical food system issues. We also produce neighborhood level data and tools that inform policy decisions, connects residents to food resources through our innovative programs and partnerships, and bring together policymakers, community organizations, and residents to build healthier, more equitable food systems. Right here at Hunter, one of those efforts is our Pantry Link program. It's a smart locker system that works a lot like a vending machine, offering free prepared meals and fresh produce to students anytime campus is open. The first machine is located by the food lab in the basement, and we hope to expand it very soon. If you haven't used it as yet, or you know someone who can benefit, I would encourage you to check it out, and please, as always, spread the word. We also create spaces like this one, where people from different sectors can come together to discuss the challenges within our food system, explore the latest research and policy insights, hear what's happening on the ground, and exchange ideas that drive meaningful change. Today's panel is the first of what we hope will be many conversations like this. Now, I am honored to introduce our panelists. Jocelyn Caceres is the director of Manhattan's First Family Enrichment Center at Union Settlement. She has spent more than 15 years supporting children and families through foster care, homeless services, and community engagement, and is overall an incredible person. Dr. Keith Chan is an associate professor at the Silberman School of Social Work at Hunter College. His research examines social determinants of physical and mental health for Asian Americans, immigrants, older adults, people with disabilities, and other communities. He leads NIH and NIA-funded studies on health equity and aging, and serves as a congressional fellow, advising the U.S. House Committee on Ways and Means on Mental Health, Substance Use, Disability, and Health Equity Policy. Dr. Wen-Yuan Wang is an assistant professor in the Department of Nutrition and Public Health. She recently earned her PhD in behavioral nutrition from Columbia University, where she developed and evaluated a nutrition education intervention for addressing food insecurity and dietary acculturation in Chinese communities in New York City. She is a culinary nutrition educator and has conducted extensive research on the upstream causes of food insecurity and the buffering effect of nutrition education programs. Dr. Jera Zhang is an assistant professor in the Department of Nutrition and Public Health at Hunter College and a registered dietitian nutritionist. Her research examines digestive health, immune-related disorders, and cross-cultural eating patterns. As chair of the AAPI Professional Development Committee for the Academy of Nutrition and Dietetics, she works to advocate diversity and inclusion within the nutrition field. I'm hoping that Savannah is here. If not, there you are. Savannah is pursuing an MS in nutrition here at Hunter. They are an aspiring dietitian with a focus on diabetes education, sports nutrition, and preventative healthcare. And last but never least is Miesha Smith, is the Assistant Dean of Student Health, and her portfolio has included managing Hunter's food pantry and fresh food program, emergency support, and other initiatives that improve student retention and graduation rates by fostering health, intellectual curiosity, and experiential learning. Together, these panelists will connect research, policy, and experience to show how the SNAP crisis is impacting our communities and what steps we can take to better support those it serves. So let's put our hands together for a panel. I'm just going to pull up a chair right in the corner here, just to save me the long walk. I'll park in the corner here. So as we begin, I'd like each of you to briefly introduce yourselves and share why this issue of food security is important to you and your work.
Hi, good morning. My name is Jocelyn, Caceres, Director of East Side Soul Family Enrichment Center. Currently, we work with East Harlem residents to provide concrete supports in times of need. This government shutdown is definitely a time of need for many of our family and residents. So it affects us in many, many ways to figure out different ways to support them in different capacities, whether it's food, clothing, etc.
Hi everyone, I'm Miesha Smith. I am the Assistant Dean for Student Life at Hunter. In my many years at Hunter, I've been here for over a decade already, which is shocking, but I've watched our food pantries grow. We didn't have food pantries, nobody at CUNY had food pantries until around 2019. 2018, we started with our first initial launch. That was really based in just residential life students. That is where this started. It started as, what about students in the dorm who need to have a can of soup to warm up instead of trying to go out in the middle of Manhattan and find something affordable to eat? That's where this idea started. And I really, I'm so moved by how we have grown because it has grown from student feedback. There hasn't been a student that didn't get a survey response immediately after coming to us for that first can of soup. And what we built and what we have evolved into throughout COVID, from mobile food pantries that we would just park on a corner of Jackson Heights and see hundreds of students come during COVID with their families for anything that we could provide that they knew was healthy and safe and reliable. It made us grow. And to see that sort of development of a program that came directly from feedback from students is really inspiring always for us in higher education. And so that's what we are here for. We're here to make sure that students can possibly study without having to worry about where is that next meal coming from, what will my little sister eat, how can I help my parents, and to be able to take any of that sort of pressure off of our students, especially during this time period that feels full of pressure. We're happy to do so. So really happy to be here and talk about how we can continue to support our students.
Thank you.
Hi everyone, my name is Jera Zhang. I'm currently assistant professor in the Department of Nutrition and Public Health, and I teach course of community nutrition education and also clinical nutrition, and also do research on behavior nutrition. So food security is definitely a big topic in our class, especially the community nutrition education class, because as a dietitian, food access is actually the basic, because without food security, people won't have enough food, and any dietary advice like increasing vegetable intake, like drinking more milk or having yogurt to boost your calcium intake, any of that won't be possible if people cannot really afford to put enough food on their table. So food security is definitely the baseline for all the nutrition-related outcome, and it's also a really key concept for all of our dietitian and our dietetic students to realize knowledge and personal choice is not the only thing. There is also structural barriers like cost, transportation, and the time, and there are so many different things affecting our health, affecting how we choose food and how to eat a healthy diet. So I'm really happy we can have this opportunity together today to discuss this issue, and really look forward to learn from everyone on the panel and from everyone in the audience. Thank you.
Hello everyone, My name is Keith Chan. I'm an associate professor at the Silberman School of Social Work. Just want to thank everyone for being here, and it's quite an honor to be on this panel with everyone. I'm also serving as the chair of social welfare policy. So, you know, I started out like really working in the field as a social worker, working with people who are, you know, older adults, immigrants, you know, people with serious mental illness. And what I've learned over the years is that the populations that we serve as social workers oftentimes deal with a lot of different struggles. And certainly food access is a big part of that. You know, from a policy perspective, what we see is that oftentimes there's not enough for everyone who needs to address these needs. And oftentimes there's a patchwork of things that people access in order to really feed themselves. Because there's really not one resource that is sufficient. So this is a topic I care deeply about, especially because of all the cuts that are happening. The people who are the most vulnerable are really going to feel this first. So looking forward to learning from everyone and also to being part of this conversation.
Hi everyone, my name is Wen-Yuan. I'm assistant professor at the Department of Nutrition and Public Health. Colleague with Mark and Jera here. So as Mark mentioned earlier, my research really focused on food insecurity, develop, evaluate, and improve nutrition education programs that can actually help people to maximize the food access and maximize the utilization of food that they can find at local resources. So we're going to definitely go through the handouts. Does everyone have a handout? So I made a handout. Usually when I do workshop at community settings, they'll be on slides, and there will be a lot more time just to teach the food pantry recipients how to navigate online resources, to find non-federal, non-city assistance program with them. It's easy to access and it's a lot more flexible. Oftentimes it doesn't require ID. You don't need to know who you are, and you can go multiple times. So definitely we're going to talk about this. I want to talk a bit more about how I got into food insecurity, and really what's happening right now makes me think why I'm here doing this kind of research. So I really started focusing on food insecurity during COVID. I felt food insecure myself as I lived by myself, and I was an international student at that time. Didn't get any family support, lost contact with school because I didn't go to school in person. So I started looking at what can I get, you know, within the neighborhood. People were afraid of taking public transportation, so really you can only get access to walkable distance places within the neighborhood. That's how I found out these resources and start talking to people who had a similar experience, especially in the Chinese American community, and I saw the needs, you know, to do more kind of workshops to tell people, hey, these are available to you, and how can you just go. You just need to go, and you need this information and share with your family and friends. So I feel this time it's not the same situation, but I think more people are affected because the federal shutdown and the SNAP benefit cut. Again, like I hope everyone here today in the audience, you can spread the word, share the information with your family, friends, even people just in your building or you see every day. Just tell them this is available.
Thank you for that. To ground our conversation today, I would like us to start with the basics. For many students in this room, SNAP might be something you've heard about, but don't fully understand. So I'd like to give some time to Jera to tackle one question, which is, for students who may not be familiar with SNAP, can you give us an overview of the program, what is its history and core purpose, and what impact has it had on food security in the United States?
Of course, thank you, Mark. I think there will be a restart of the panel, so to talk about history of SNAP. So I believe a lot of you heard about SNAP in the news recently. So just to start with the basics, SNAP stands for Supplemental nutrition assistance program. So it's a federal food assistance program managed by the Food and Nutrition Service, and serve about like 42 million people in this country. And primarily it serves people who have low income, especially for like vulnerable group, like older adult, children, including like also students, like college students, also people with disabilities, like all the people who are disproportionately impacted by economy or all the different life circumstances. And SNAP really provides assistance for them to afford healthy food, to can put food on the table. So I know we talk a lot about SNAP, like what SNAP is, what SNAP does in class, but today I also want to share a little bit about like a history, like when it started and how it started. So everything actually started in 1930s during the Great Depression. That is one of the hardest economic kind of times in the U.S. history. A lot of people out of work and not able to afford food. And that is when the SNAP, like the first food stamp program, back then we call food stamp program, that kind of took shape in that time. So back in that time, also the U.S. faced kind of two big problems. So one of the problems is that we have farmers. They produce a lot of food, and sometimes they produce too many food that cannot sell. So the price of their product keep like dropping, and also it's hard for them to make a living. And on the other side, the second problem is that we also have a lot of families living in the city, and they do not have enough money to afford food. So it is a huge gap. And back then, there was one of the kind of earliest administrators of the food stamp program, and his name is Milo Perkins. I don't know if anyone heard of him. He is kind of a pioneer in food stamp program, and he used a really simple and powerful way to describe this problem. He said it was like looking through a deep valley, and on one side of the valley there are extra piles of food, and on the other side of the valley there are empty hands and empty stomach. So he said it's very important to build a bridge across this gap to really help the farmers to sell their food, also help the people to feed themselves. And that is actually what the SNAP program means in that time, to connect the surplus of the food to people who are really hungry, so no one will go hungry again, and the farmers can keep producing their food and sell their food. So yes, that program still continues today through SNAP, and that helps millions of Americans to afford healthy food on their table. So that's actually kind of how it started. And then like move on to like 1960, there's also this act called Food Stamp Act that actually helped to formalize the entire food stamp program. And so it has aimed to kind of first like support the farmers, and then to prevent hunger in this country, especially in low-income families. And after that act, the kind of the food stamp program become permanent. And over the past few decades, it also keep evolving over the years. For example, it's added, kind of expanded the eligibility, added certain components, including nutrition education to improve health among people who have lower income and need assistance. So like today, that is kind of came to what we know as the STAMP and the SNAP program. And also I want to quickly talk about why the SNAP program was called Food Stamp before. So actually that really captured how the food assistance was delivered back then. Because in old time there's no electronic system, there's no credit card, debit card, or online system to deliver the benefit or deliver the assistance. So the government, like how can they do that? So the government decided to print this paper stamp to give to people, so the people can use the stamp to purchase food. So those stamps just look like small colorful coupons people use to do their grocery, and they actually look like, I don't know if anyone played Monopoly, the board game. They use like fake money to like exchange rate for the game, and the food stamp actually just look like that, and that also gave the name of the program, so food stamp program. And later on, when we're kind of in more modern society, I think it's around like 2008. And then people think the food stamp probably can create like stigmatization, like give people stigma when they like show the food stamps. And then once at the same time, they're transferred to like the electronic system. And then they decide maybe we should change the name from food stamp program to SNAP. So that's how we got the name SNAP. And now we have this electronic system. We use our card called EBT card. EBT stands for Electronic Benefit Transfer Card, and it works as a debit card. People can easily use it to purchase their grocery. So yeah, that's such a really great advance in the program, and it also help improve the transparency and also secure the accuracy of the program, because every swipe it left a record, and the government can better track how each dollar is spent, and actually it helped a lot with the program accuracy. And I think based on some stats, I think the fraud rate has decreased to around 1%, which is a great advance in the development of the program. So yeah, so that's STEM. That's what we have today, and I also want to kind of include some numbers to show the impact of the SNAP. So the whole country already mentioned it serves about 42 million people, and in New York State it serves about 3 million people. And in New York City, about more than 60% of the 3 million people in New York State also receive STEM. So it just helps so many people in New York State and in New York cities, and it's really powerful. What else I want to add? I think I also want to add SNAP, although the goal is to kind of assist people to put food on the table, but it's not really a charity program. It also have economic benefit, because based on the studies, the SNAP recipient usually can spend all the benefit received in the first month. That means all the federal money they receive can quickly flow back to local economy, right? It can act as economic stimulus, and there's also data show that every SNAP dollar can generate about over $1.5 of economic activity. So it definitely have a great economic impact as well.
Right.
Yeah, so it's not only kind of a system program, it also have great economic benefit, and not just for all the food security problem, they're also associated with different chronic health problem, different things. And the SNAP also can help the family afford some healthy food and prevent chronic disease, so it also can benefit the health care in the entire country. So yeah, I would say just to summarize, SNAP has huge benefit, not only to just help people afford food, but help with the economy, help with the whole long-term health of the whole country.
Thank you for that comprehensive overview. As we move forward a little bit, now that we have a generic understanding of SNAP and what's happening to it, let's talk about impact. And these aren't just policy changes or administrative delays, as we're seeing. They have real consequences for people's health and communities. So Keith, let's start with the research perspective. Your research focuses on social determinants of health and population health. Can you help us briefly understand how government shutdowns and disruptions to safety net programs like SNAP can affect health outcomes for college students, immigrants, older adults, people with disabilities, and other communities?
Sure. Yeah. So there's a lot of different impacts that happen, right? Because, like I said before, we have a lot of folks who are really vulnerable, and with older adult populations, immigrants, children, these are the populations that oftentimes depend on these programs the most. So if we look at some of the numbers, right, right now the annual budget for the United States is roughly about $7 trillion. And what we spend on SNAP is roughly speaking about $100 billion. But we're talking about a lot of people here, right? So when we're talking about $100 billion for literally about 43 million people in the US, we're really talking about literally about a little less than $200 a month. So when you really do the math. And so, when we're talking about also, people in New York State, right, we're talking about 4 million people, It's very hard for us as a state to really kind of catch that hold. Even if we have, say, I think like in the news, Governor Holco had committed, I think, what is it, like 40 million or something like that. And then there's a little bit more money, but $40 million for 4 million people is essentially about $10, right? So it's so a lot of this money that's coming in from the federal government, it's really necessary. Because of the shutdown, it's really made a lot of different impacts on different communities. And something else I want to talk about too is that when we talk about SNAP is really just one component in terms of the patchwork of supports that people really access. There's other things like conflict training, there's food pantries. A lot of these other services are actually supported directly, either by federal funds or indirectly. So when we're seeing cuts across the board, we're not just talking about one program, we're talking about different programs that people depend on in order to feed themselves. So in terms of older adult immigrants, children, a lot of these folks who are really the most vulnerable, they're going to have the hardest time in terms of even being able to feed themselves. And on the other side of that too, when we're talking about social welfare systems and programs like Medicare and Medicaid, those are the programs that actually help to keep people healthy. So if we're cutting food access, and we're also cutting healthcare, then people really have nowhere else to turn.
Wow. Thank you. Talk about perspective. Jocelyn, how are you seeing this play out in real time on the ground? What are you seeing on the ground in terms of food insecurity in East Harlem? And how has the government shutdown and SNAP delays affected the people you serve?
So on the ground, right? Sorry, I keep forgetting to turn it on. So on the ground, we're seeing a real increase in families struggling to meet their basic food needs, right? These delays are now, our families are facing harder choices, and that's whether to put food on the table or fall behind on paying rent or utilities. Our neighbors have also expressed, even though they've had these benefits prior to the shutdown, it's still not enough, right? The cost of food is so high that these funds are running, they're gone by mid-month, which it's forcing them to have no choice but to go to local food pantries or come into spaces like ours for a meal. We have noticed higher demands in not just East Harlem residents, but citywide. We're getting calls from families in Brooklyn, Queens, asking for resources in terms of pantries or if there's any food pop-ups that they can attend to. But the reality is that the impact is widespread, and it's not just affecting East Harlem, it's affecting all the 5 boroughs.
Thank you. And when government systems are disrupted, what does it look like in practice for community organizations to step in? What toll does that take on organizations like Insecurity?
So it's a call to action for us, but it's also, as prideful as we are in the work that we do, it also puts a lot of pressure. We're a small but mighty team, but we also rely heavily on partnerships and working with local organizations to assist us to create these pop-ups or be able to provide food for us to be able to distribute, right? And although we do have funding, our funding is limited, and we do have food on site every day or something for families to snack on. It's just not sustainable for, let's say, a family of 7 who has nothing at home. So we can feed you on the site, but we really want to long-term give you something sustainable so that you can go home with it. So we rely heavily on partnerships to help us through this shutdown.
Thank you. And Miesha, I wanted to turn to you to ask what kind of resources does Hunter College offer to students who are experiencing food insecurity?
Yeah, I think very similar to Jocelyn. It's, 10 years ago, this was not the business of a higher education system, right? We worked in partnership with a lot of nonprofits to provide students with options that they could find in their neighborhoods, food pantries that they could find near home. And one of the things we found was that if they were in class and at school, they were missing those food pantry hours in their neighborhoods. And so by offering our food pantry, we're open 6 days a week. Every CUNY has a food pantry on their campus. The hours are different for each of them. and we're open to all CUNY students, so it's not just Hunter students. So it really is a framework where if there's a CUNY that you're not attending, but it's closer to your home and it's easier for you to carry groceries from there, go to that food pantry, check those hours. CUNY has a really great hub website with every pantry's hours. And I think that what we've been seeing is shocking numbers of visitations. We have more than doubled where the number of visits we've seen this semester alone to last semester and last year. And we have great community partners, we have great funding partners, we have a fantastic relationship with the Petrie Foundation who has been so responsive, but almost every pantry in New York City is getting their food from one of the same three sort of organizations. And not gonna say how aggressive I am about getting turkeys for other pantries right now, but we're fighting each other. And it's demoralizing to see that. It's demoralizing to know that somebody in Brooklyn is not getting turkeys because we are in Manhattan, but it's the reality of the situation. And so we have a fantastic partnership in the Food Bank of New York. So if you are looking for a place to give this holiday season, I really couldn't stress the Food Bank of New York enough. We are also collecting donations and financial donations. And I think one of the other things I want to say is so many people have reached out to me personally saying, can I bring a bag of groceries? Can I bring some extra things? And that is very nice. But we do have these partnerships to maintain a very strict health code, a very strict offering of food to our students, and we also get it for like cents on the dollar versus what you're paying for it. So it's not that I just want money, but it is, we can stretch that dollar a lot further by shopping with the food bank and getting things for cents on the dollar. And so with these partnerships, we are able to have our pantry open 6 days a week. We have fantastic student workers who staff our pantry. We have amazing help from the facility staff and public safety staff. This is not in their job description to be unloading pallets of food twice a week for us. We have a fantastic relationship with a group called BNY that provides us fresh produce and fresh vegetables and eggs. Each student gets 2 cartons of eggs while those supplies last, and they go the day that they are dropped off on our campus. So we're seeing all-time high numbers, but we're happy to know that students know who we are. They know where to find us. They know that they can get a safe and healthy option. And I really wanted to point out too, there's a real lack of fear, this lack of stigma now. Our pantry is a bright, happy, fun space. We have a little group of student volunteers called the Pan Fam, really sweet. If you follow them on social media, I love it. It's so fun. It's such a joyful place to find community, to find resources, to find help in a real judgment-free way. I've had so many students who have come to me and said that they're struggling, and I'm like, well, go to the pantry. And they're like, no, but I don't want to take away from people who are really struggling. We're struggling, all of us. I think everybody up here is like, I could use a free bag of groceries. Please, my message to any student out there is please don't think that you're not the student we're trying to help. We are. I don't care if you come down and you're like, I get paid on Thursday, it's Monday, I need some rice, I need some beans. Come down, get it. We have frozen meat, we have halal, we have kosher options. We really try to be as inclusive as possible, and we'll continue to do so as much as we can in this time period. So I really want students to know that up here at Silberman, you have the Smart Link pantries, which are fantastic, and I know Mark is doing so much work in trying to expand those options as well, and expanding those down to 68th Street. But at 68th Street, we do have our pantry open 6 days a week for you to stop in and visit, say hi, grab something, try it out.
Thank you very much. As we transition, and we've been talking about SNAP and how it's disrupted our communities, and it's through its impacts from the cuts. We need to also ask ourselves, what does it actually feel like to live on a SNAP budget in normal times? And Jera has been teaching students about this through a powerful assignment called the SNAP Challenge in her community nutrition education course for years. So, Jera, can you describe what this assignment entails and what you hope students learn from living on approximately $7 a day for 5 days?
That's good. Thank you, Mark, for asking this question. This is one of my favorite assignments for our students. So in our community nutrition education course, each year we have assignment called SNAP Challenge. So this is experimental kind of assignment, and we'll ask students to kind of live on a budget for 5 consecutive days. It's the same budget someone receiving the SNAP benefit will live with. So for our students, it's about $7 per day, and for 5 days, it's $35 in total. So as he's already mentioned, although the total number of SNAP budget in this country sounds really huge, but if we divide it to individual, it's not a lot. So for our student, based on the data from New York State, we use the same budget, which is $7 per day. So what the student would do is they will ask to first make a meal plan, and using the $7 per day and $35 for 5 days budget. And at the same time, they are also asked to try to follow the dietary guideline for American to eat healthy on this limited budget. And then they will kind of make the plan and carry out the plan and record everything, like what they shop, where they shop, what portion size, what they eat, and how much money they spend. And after that, they will also write a reflection to write about what happened during this challenge. Did they finish the challenge, complete the challenge, any trade-offs, any compromises, any kind of surprises they found during this assignment. So I would say honestly, reading this assignment is like really, really interesting. And all the students inside, they're super powerful. Like I heard, I really like some student commenting on, oh, I didn't realize how much mental stress it costs to eat healthy on such a limited budget. And they also comment that they kind of, after this challenge, they feel it's a luxury to have the flexibility to choose what they want to eat on a daily basis. So many of these comments are so powerful, and I really think this assignment helped not only students, also myself to build empathy and awareness of how to eat healthy, limited budget, and eating healthy is never a personal choice. It's not only about knowledge, but it's also about the cost, the time, the transportation, the price checking, so many different factors can affect. Can affect how we eat with a limited budget. So yeah, I would say it's such a rewarding thing to read student reflections, and we are so glad to have one of the students here to share her experience with this assignment.
Thank you. And on that note, I would like to welcome Savannah to our panel. Over there, and there's a chair as well. Sure, go for it.
Hi everyone, I'm Savannah. I'm a senior in the Integrated Program in Nutrition and Dietetics here at Hunter on the path to becoming a registered dietitian. So I completed this project in my community nutrition course last year, and it was one of the most impactful projects during my time at Hunter, now going on 6 years. Having type 1 diabetes, training for my first powerlifting meet that November, and being a first-year graduate nutrition student, my approach to the challenge was to focus on meal balance and protein intake while following the recommendations listed in the dietary guidelines for Americans. The budget was $6 a day for 5 days at the time that we did this project. I shopped at several different stores that accepted SNAP benefits, both near the Brookdale dorms where I was living and around Silberman, to get a sense of what's available in Harlem too, including Target, Trader Joe's, Food Town, City Fresh. I stood in the long line at the Dollar Tree down the block. I remember being shocked by the stark difference in egg prices, anywhere from $5 to $9 in local Harlem grocery stores compared to $2.99 at Trader Joe's. I also waited for over half an hour at the Purple Pantry for free groceries, but I tried not to rely on them to stay true to the budget. My meals ended up including peanut butter toast with bananas, egg salad sandwiches, instant coffee, whole milk, chicken with frozen vegetables and lentils, cherry tomatoes, tuna fish, and oatmeal. I seasoned the chicken with 3 herbs I got from volunteering with Edible Schoolyard. While I adhered to the dietary recommendations, I failed to meet my calorie needs. In addition to being noticeably more hungry, I went in low blood sugar every single day of the challenge, sometimes more than once. Not only can hypoglycemia make you want to eat everything in sight and disrupt your workouts, my lows ended up costing about 10% of my budget, money which I could have used for more satiating food. It highlighted how chronic illness exacerbates the struggles faced by those living with food insecurity. During the challenge, one of my best friends wanted to spend time together, but I didn't have room in the budget to go out to eat. Honoring the integrity of the project, she brought over chocolate-covered pretzels and helped me calculate the cost per pretzel. It was the only sweet treat I had during the challenge, and it really boosted both my mood and my energy. While the meals I had were healthy, the low volume I was consuming made me realize why people living in poverty might reach for calorie-dense, nutrient-poor food options, especially when that kind of food is cheaper, more accessible, and can make you feel more satiated. Given the gravity of the project, I shared my experience on my Instagram and was taken aback by how many viewers engaged with the content. Some were inspired by my simple but balanced meal prep ideas, while others shared their own struggles growing up with SNAP, suggested how to keep my gains during the challenge as I prepared for my powerlifting meet, and expressed concern with the lack of support for those struggling with food insecurity. One of my followers shared that their professor offered free meal swipes to his students if they ever were in need, but that this was the only time a professor ever mentioned food insecurity. They also expressed frustrations regarding their institution constantly promoting meal plans, but failing to communicate the availability of nutrition-related resources like food pantries. Food insecurity is unfortunately more common than some may realize, even within our own communities. The 2022 CUNY Student Experience Survey reported that 40% of CUNY students experience low to very low food insecurity, an estimated 110,000 students. Completing this challenge shaped my understanding of food access and security by underscoring why people in poverty make the nutrition-related choices they do, why our current systems cultivate the health disparities we see today, and why nutrition support systems are imperative. Food is at the very base of Maslow's hierarchy of needs, and simply put, food is a basic right and necessity, as well as an important element of community and culture. With SNAP benefits and such limited resources, you can focus on quality or quantity of food, but it is really difficult to attain both, not to forget the time and energy I've spent on shopping at several different grocery stores. These benefits, though, are essential to helping low-income individuals meet at least the minimum nutritional needs. I ask that anyone who criticizes these support systems to take a step back and perhaps even try this challenge before taking action against programs like SNAP, because experiencing these constraints firsthand makes it evidently clear how vital programs like this truly are. Thank you.
Thank you very much. We've heard about the crisis and its impacts. Now let's talk about what's being done and what resources are available. One, what are some of the most effective apps and digital platforms that can help students and community members locate food assistance programs?
Yeah, so hopefully everyone gets a copy of handout. So to answer Mark's question, I will briefly review the handout, and hopefully you can share this information with your surroundings as well. There are some key resources that I have used and I have shared with my some food pantry recipients. So Food Help NYC is a city-built website. You can go up there, put in a zip code or by borough to find your local food pantry and soup kitchen. And then Plentiful app, an app that you can download to your mobile phone if you have a smartphone. Hopefully everyone has a smartphone. This is a very powerful app. It's funded by many organizations that work on food insecurity together in New York City. And they try to update information as frequent as possible. So on this app is like a Google map. You can find your current location and it will show you multiple dots around you. And then just click on the dot, you will see the information about that food pantry or soup kitchen, including like operation hours, whether they have walking service, what kind of food they offer. Sometimes it's kosher if you go to certain neighborhoods, or if you're looking for halal food, if you're looking for culturally relevant grocery, like Asian grocery, you can go to Chinatown or certain Chinese communities within the 5 boroughs. And then our Food Policy Center made this amazing neighborhood food guide. So I include the website link here as well, but you can just search on Google. What's the keyword mark?
nycfoodpolicy.org.
Yes.
It's available there as well.
Yes, so I have shared this guideline with a lot of seniors because this to them is the easiest, the most accessible. They don't know how to use apps, they don't want to know how to use apps sometimes. And this, you can just print it out. If someone comes to you and asks you, or just email yourself, where can I find food pantries, community centers, hours for pharmacy even. So it's really by boroughs, by neighborhood, and it offers multiple languages. For example, in Chinatown, Manhattan, it has a Chinese version of it, and if you look up in Harlem, then there's a Hispanic version, or in Astoria, I believe there's French as well. Multiple language available. And you can just print it out and share with people, or if you have seniors that need this kind of resource. And lastly, there are churches, there are community fridge. So there are fridges on the street that's available to anyone 24/7. People will leave food that's for anyone. You can open it, take it, no question. There's no monitor, no camera. So these are all available resources for people in New York City if you're looking for something local. And as Jera mentioned earlier, transportation time also counted as food cost. That's why we want to promote the maximum usage of your local food resources. And also, as I think Jocelyn mentioned earlier, the people calling from different boroughs looking for resources. Like if someone's calling from Brooklyn, maybe I would say deep Brooklyn, it's an hour and a half travel time, commute time to here, so that you can save them some time to find local resources like within 15-20 minute walk distance. I think this is also very important. Time is a cost. They can use that time to wait in line at their local food pantries. They can get food from multiple food pantries instead of just traveling far for something else. Like I know there are food pantry recipients traveling from Brooklyn, like to Sheep Cafe to Chinatown, Manhattan, just because there's Asian grocery available to them. And lastly, I think, so how to find sites by zip code, by neighborhood. Also, you can look for ready-to-eat food or food packages that they're fresh produced, staple food. You can come, well, I guess like now, because they're so overwhelmed, you may not be able to pick the food. Usually they will pack everything together in a package and people go wait in line to pick it up. But some food pantries allow recipients to go in and find the food that's tailored to their needs. Yeah, and then sign up if sign up is needed. Plentiful is a good place to do that. It shows you whether you need appointment. If you need appointment, how frequently you can get appointment. Sometimes it's bi-weekly, it means you can only go every 2 weeks, but then there are walking hours, anyone can just go and pick up food.
Thank you very much. As we're wrapping up, I want to pose two questions, one to Jocelyn and one to Miesha. And then we're going to jump quickly into some Q&A section. Jocelyn, Eastside Soul focuses on connection and mutual support. How do community-based approaches and organizations like yours complement government programs like SNAP in addressing food insecurity and supporting our community?
So at Eastside Soul Family Enrichment Center, right, we're a center where neighbors can connect, contribute to the community, but also find resources. And although programs like SNAP are essential, they often cannot reach, right, the deeper social and emotional need that come with food insecurity. And that's where our organization sort of steps in. We create a space where families can come together, share a meal, learn about nutrition, or connect with neighbors who understand their challenges. But most importantly, we're just meeting people where they are, right? We open our doors, it's confidential, they don't have to sign in. It's just an open comfortable space for you to come in to express your need. And that's what we try to do as best as we can, right, to bridge these gaps. And to listen, right, to listen, to understand exactly what families want, and respond with compassion and empathy.
Thank you.
Mark, would you just take a minute to let folks know how we got in touch with Jocelyn? Is Jenny still here? Yes, so,
Thank you.
yeah.
Thank you very much for connecting us.
From the Provost's office, and how she hopefully will connect us with other.
Yes, we do have to thank Jenny Tooten, who's in the audience, for connecting the Food Policy Center with Eastside Soul and all the amazing work that
Yes, let's give her a round of
And my final question, Miesha, how can the Hunter community contribute to the work you were doing at the local bank?
Yeah, so I mean, I invite everyone to come down and visit, say hi. If you feel like a workout one day, stop by on a Wednesday when we're unloading pallets of food. Really, just don't need a gym membership. And I think, as I said, giving, you know, we've put out a call from our institutional advancement team. We're accepting donations right now. We are spending a little over $5,000 a week on food for our food pantry. That's donation-based. And I think more of that support is always great, but just telling students about us, letting them know. I think one of the really important things that was brought up here today is everybody feels like they're stealing from Paul to pay Peter, right? Like it's one thing that you're gonna drop $200 on this week, and it could be a Metro card, it could be food, it could be rent, it could be utilities. And so we're here to try and help offset as many of those things as possible. So when you come to the pantry, you're gonna see meat and fish and vegetables, but you're also gonna see paper towels, you're gonna see toilet paper. We get lucky every once in a while, the food bank will throw in some dog food, which is incredibly popular, but people have pets, like that costs money too. Formula, if we have it, we try to have as many options as we can. But I do also wanna, like this was a great handout with some options. But if you need like childcare, the college has a childcare center at 68th Street. It's a highly reduced childcare cost. If you're coming to campus, if you want to bring your child to campus, as long as they are able, they think they have to be 2 years or older. That's a way to offset some costs. The reduced fares, I know I've sat with students and tried to do the application. It is a beast of its own, but it's worth it. It's a significantly reduced fare for Metro cards. That's a really hard thing for students to manage. If we're talking about more apps that you can use, Too Good To Go is a great app that you can utilize in your own neighborhood, if you're around school, if you're in your actual communities, where restaurants will say that, hey, you come get a dozen bagels for $3 at the end of the day. They are the same bagels. They are perfectly good. They are $3. So, you know, I'm not a huge subscriber to like, you know, Hunter students have grit and that's what makes them so great. You do have grit. It's great. You shouldn't need so much of it. And so please allow us to help. So tell a friend to tell a friend, bring it up to a student, let them know. Google Hunter College Food Pantry. You will find us. You will find our hours. And as long as you can get to campus, somebody will get you into that food pantry. Public safety officers will open it for you. We're really here to try and be as helpful as possible. But I will say, we are like many other food pantries in the city. We get a delivery on Wednesday, it's gone by Friday. It is really tough. We have seen students lining up knowing that Wednesday morning means delivery time. So we will be constantly increasing and trying our best to keep up with demand. But don't let that make you not come. If you didn't get it 1 week, if you didn't get the almond milk that you really wanted, just try to come a little earlier next week. But we will be there, and we'll be there to support as much as possible. And I also want to say, we know that the toll that this takes from a mental health perspective, I think even for those people who might not need food stamps, who might not need the pantry at this moment, it can be really difficult to feel like you're in a space that people might not care about you and don't care if you eat and don't think that you should or think that you're less than. And we don't here. So please come to us. Hunter has a great counseling and wellness center. It is a place where you don't have to feel, another place where you don't have to feel ashamed to go to. But everybody needs a little talk. Everybody needs to feel a little community. And as much as we try to feed people, we're trying to build that as well. So, friend, if you're in need, if you just want to stop by, we love having people come through and showing our students that it's a great place to be and it's a resource for all of us. So, thank you.
Let's put our hands together one more time. My wonderful team. Team, can you please put your hands up, all you wonderful people? Thank you. And for those who had some food, I'd like to thank Amor Cubano for providing an amazing meal for us. And for those of you who would like to take a bag of produce, please help yourself. There is no need to ask for anything. Take what you like. It's right in the corner here. Or you can ask any of my team. Please put your hands up again if you would like them to bring a bag up for you. With that being said, though, I do want to open the floor for any questions or things that you would like to pose to our panel. So the floor is open. Any questions that you may have? Yes.
So first of all, my name is Delano Lewis, and I am co-executive director of Welfare Rights Initiative at Hunter College. And I just want to say thank you to the panelists. It was such an informative and engaging, just to listen to the different ideas, policy, practice. And I can attest to students coming to the Purple Pantry, my students going to the Purple Pantry and coming back and sharing the information with other students. So I think that sharing forward is really important. I don't so much have a question, I just want to share a resource or just to remind students that we, in addition to thinking of the baseline supports in terms of pantries, etc., one of the things that's really helpful for students to understand is that, especially as a college student, it has always been the case that students need to work 20 hours a week in order to be able to access SNAP benefits, regardless to the stereotypes that you're hearing in the media. And I think one of the things that most students don't understand is that if you're a student receiving federal work study, every hour counts and can be attributed and count as part of your eligibility. And there's nothing in the federal law that said it has to be a certain amount of hours. So for example, I have students working 10 hours work study and that alone qualifies you to receive SNAP. So I think it's really important that a lot of students, sometimes when you fill out your FAFSA, free application for federal student aid, sometimes you forget that you follow up with your financial aid at Hunter, so that even if you're not allotted federal work study that semester, you can get on the wait list. And our financial aid office at Hunter is really amazing in terms of calling students off of that wait list. But work study is such a critical piece in terms of college students being able to qualify to receive SNAP benefits.
Thank you. Thank you for that amazing point.
If I could just add to Welfare Rights Initiative is a great place to go to also at Hunter to get resources and to understand the full scope of benefits that you could qualify for. But to the work study point as well, work study is great because you're also getting student-friendly jobs. Like Target doesn't care if you have finals, right? Like Women and Gender Studies office will, right? So just another plug for work study jobs.
Thank you. We have another question back here. Go ahead.
Hi, good evening, well, good afternoon. I'm actually a grad student here, and I'm also doing my placement at Hunter Community College. I am a clinical social worker, part-time. I'm a behavior therapist, and I feel like thank you for all the resources. I actually use Plentiful as a great map. I share with a lot of my clients. The only thing I'm having an issue with is like my clients trusting me with this information. It's like, honestly, like, everything going on, how a lot of my clients are immigrant students that I gotta serve. So is there any way that we could contact, I guess, the organizations to know if they're gonna bring any type of ID, or is it walking? Because a lot of clients ask me, I don't have an ID, or I don't have legal documentation. Am I still able to get the services?
I can answer that just regarding when you use Plentiful, there's always a number. Well, not always, but 90% of the time. When you look up the pantry or soup kitchen, they have a number you can contact. And then definitely, I think most of the walking hours, you don't need an ID. Just wait in line, they have your food.
Thank you.
I would also say at any Hunter or CUNY pantry, you just need to show that you're a student. Unfortunately, just because of the demand, staff aren't going to be able to qualify, so you want something that just says you're a student. And but that is a real concern. I think lots of people have. I don't think any of us have heard of any sort of like federal agents at pantry sites or anything like that at the moment in New York City. I don't know if that could change, but certainly within CUNY, students should feel really comfortable coming in and only showing and proving that they're a student.
Thank you. Thank you for that. We do have a few questions from our attendees via Zoom. One of those questions are, what efforts are there within Hunter to help students apply for SNAP? And what additional support is there and that is needed for them?
So I would say, Delana, are you okay with me? Delana, Welfare Rights Initiatives is a great place to go for help working through the SNAP application. There's another office called CUNY Edge. It is it's a CUNY-wide initiative, so at every CUNY they have a CUNY Edge. At every senior CUNY college they have a CUNY Edge. I don't know about the community colleges. But CUNY Edge at Hunter works really hard with students who are on HRA and getting HRA benefits already, but can guide any student through the steps to apply for SNAP benefits and understand what you qualify for. I know there are a lot of different charts and things online, very confusing, but sort of like a lot of FAFSA and other federal aid groups, it really depends on your household size, who makes up that household, and then the overall income for that household. And that can really change from student to student on how that is calculated. So I would really recommend going to CUNY Edge, going to Welfare Rights Initiative at Hunter College and making an appointment with them, and they can help walk you through it. And understand the benefits that you have right now and when those might get paid out as we all know, things are happening at every moment. So some people are getting some payments that are funded by the state. Some people might get them a little later in the month. Some people might get partial payments right now. So all of that will change, and both of those places, Welfare Rights Initiative and CUNY Edge, are great places to get that information as well, if you are also getting benefits from them.
Wonderful. Our final point for today.
I would just want to put out Access HRA app for anyone who, if you just type that in, you'll get to the website, but you apply for all of these benefits online. The thing about Welfare Rights Initiative is that oftentimes students are eligible and they have all of their paperwork and they're still denied. So having a policy advocacy and legal advocacy arm of Welfare Rights Initiative, we're able to provide students with the right resources and the know-how so they can self-advocate.
Thank you. On that note, thank you very much for coming to our panel today. And for everyone who was able to attend between your classes. So thank you very much. Please be sure to sign up for our newsletter. And also please remember to take a bag of produce with you as you're heading. Thank you very much. And thanks to our panelists.